Good morning. Thank you for joining me today. As I have observed here in Melbourne, you have a fantastic opportunity to play Pokemon Go on your free tram and get steps without actually walking. I know that's sort of cheating, but the fact that you're here and not there warms my nerdy little heart. So I want to talk to you about something today that's really important to me and should be very important to you, and it's about the impact of nursing informatics. And the reason I want to talk to you about the impact of nursing informatics is because let's just talk about what the impact of nursing is and the reason why people go into nursing. If you ask anyone why they go into nursing, healthcare, any aspect of healthcare, it doesn't matter if you're on the IT side of the fence or you're in direct patient care, the answers they'll give you are varied, but they all come down to one thing. They want to make a difference in people's lives. They want to make an impact. And so that was exactly why I chose to be a nurse. But when I got on the floor, I decided that didn't quite strike my fancy enough. I wasn't making enough impact. So I discovered the field of nursing informatics, and everything sort of went from there. But before we get into, the impact that informatics nurses make, we must first define what nursing informatics is. And there is a very technical definition that says, not a whole lot, that basically says nursing informatics is a science and practice of integrating nursing, its information and knowledge into the management of information communication technologies to promote the health of people, families, and communities worldwide. Now that definition is from 2009. You do need to know that in the United States that nursing informatics has been considered a nursing specialty since about the 70s, but has really been taken into consideration, sort of jotted down on the books in the recent years, I believe in the 90s. What does that mean though, right? That's a big fancy definition that when you get right down to it doesn't tell you a whole lot about it. And if you're new to the world of informatics, that basically is something you can put in a research paper, or that I can put on this beautiful slide here. I also have a diagram that essentially says the same thing in diagram form, but again, that doesn't tell you a whole lot about the work that nursing informatics do, or what it means to be an informatics nurse. So you're probably asking yourself now, unless you're one of the very small percentage of the population that is an informatics nurse, or have an inkling of what is the job, what does that mean? So what does an informatics nurse actually do on a day-to-day basis? It's a really good question. In fact, that's one of the number one things I'm asked. Number one, I'm asked, why did you stop being a nurse? Which I always giggle. Because I am still licensed as a registered nurse, and I very much consider myself a nurse. I just have different patients. And one of my favorite things about informatics nursing is nobody dies in IT. I only have to worry about computers, but I do have to worry about the nurses that I impact through the work that I do. So what do they actually do on a day-to-day basis? Well, it's a lot of different things. And an informatics nurse may be called an informatics nurse, but they may be called any one of about 20 to 30 different job titles: clinical specialist, clinical informatics specialist, and they actually may work in many different settings. In the hospitals, they often work in education, sometimes they work in IT, sometimes they do things that technically aren't really informatics type work, meaning they don't deal with the data as much and making the data meaningful and doing meaningful things to improve patient care. They do more client support type things, but everybody's sort of got to start somewhere, and that's usually the entry level into practice, is doing some level of technical support, some level of implementation for software systems, some level of support for an organization. They do a lot of different things in this responsibility. They're project managers, they implement things, they write technical documentation, they communicate with leadership. But it all boils down to it, like what is the basis of nursing informatics and what truly makes a good informatics nurse? And if you had to describe it as one thing and nothing else, what would I say it would be, and what would I suggest that you take as your definition? And that would be a translator. And truly, nursing informatics is the translation between the nerds and the nurses. You've got to have somebody in there that gets both sides and that advocates for both sides of the fence. Because if you're constantly going at odds between the needs of the IT department and the needs of technology in general and the needs of the nursing staff, you're never going to win. You've got to have the person that meets in the middle, that shakes both hands, that gets both sides of the story, and can tell a story that translates to both what the patients and the nurses needs, but also what the IT people need, who in many cases have never worked in direct patient care and frankly just don't get it. So being an informatics nurse means you play both sides. You're the pitch hitter. You play both sides of the fence. And that is what it really takes to drive healthcare forward and to really pursue a world where information technology is bred into everything we do with patients and actually helps us to deliver better patient care. If you don't have those people that are working to make sure that things are done right, that are working to make sure that the workflow of nurses is observed when you implement EHR system, which, by the way, the U.S. has done a terrible job of, you will have it fall flat and it will not be effective, and you will have instances where hospitals will spend millions of dollars to implement EHR systems and the staff will revolt. And it will be a huge failure. And in fact, I've heard of many cases, I know you guys have had some examples of that as well, where they spend all this money implementing these systems, they absolutely hate it, doesn't do anything for them, and they stop, and they buy a new system, and they start again, because they naively thought that the system was what was to blame. Fortunately, that's not usually the case. What you'll learn as you use EHR systems is they all have their quirks, they all have their things that they do great, they all have their inconveniences. They are a little wonky, but in the end, an EHR is an EHR is an EHR. And it has less to do with who you buy, how much money you spend, and those sorts of things as to the workflow that you did to do it up front. So with that, let's talk a little bit more about what it means for you guys and your workforce. So I dug a little bit into your research, and I found that about 62.6% of Australian nurses, or about 174,000, work as clinicians in hospitals. Now, I know you have a lot of general practitioners, and so I'm not including those in these ratios because those numbers weren't as pretty to me. So I'm talking primarily about nurses in hospitals because it makes my diagrams look a little cleaner. So out of 13,026 hospitals, and that includes both private and public care, we average that down to about 131 nurses per hospital, and on average, it's about 5 patients per nurse per shift when you're talking about, your basic bedside care nurse, your tried and true what we call a med-surg nurse. So these are general statistics. You also have about 2.6 people per household in Australia. And again, we're looking at primarily clinicians that work in direct bedside care. So how many people do they impact on a daily basis? You as a nurse, or you as not a nurse, many of the people in the room are likely not nurses. How many people do they touch every day? Because that's what they want to do, right? The very first thing we talked about this morning was the fact that you become a nurse because you want to make an impact, or you become a physician because you want to make an impact, and you become a hospital CEO because you want to make an impact. So how many lives do they touch on a daily basis? Now, in its simplest form, I've just done some really basic math that basically says one nurse touches 5 patients, it touches 13 lives. Now, we all know it ripples beyond that. It's not just as simple as that. And we all know that they touch the people that they interact with on patient care. But just in its simplest terms, one nurse has the ability to impact 13 lives every day. For me, when I was a nurse on the floor, that was not good enough. It's not good enough. I wasn't making the difference I wanted to make. And you'll find that many clinicians have that same issue. They're not making the difference they want to make. And in many cases, 5 patients is even too much, and they're not making the difference they want to make because they can't even see the patients they have in order to make the impact on those lives. But there's some weirdos, the people like me and the people who pursue informatics nursing that decide they want to do something more. They want to touch more lives. They want to raise awareness on certain issues. They want to fix certain things that they see, and they want to climb the clinical ladder. And in many cases, they try to climb the clinical ladder, and they learn that someone will need to die before they can evolve in their position. The hospital hierarchy doesn't make it easy for you to grow in your profession, and standing here as someone who's 30, who developed software at one of the leading workforce development solutions in the United States and has the ability to impact 70% of U.S. healthcare, I am the exception rather than the rule. You will not see people like me in these positions. Why? Because I haven't been a nurse for 30 years. And to some people that means by golly, I wouldn't be able to know what I was talking about enough to make an impact on anything, and technically usually wouldn't be taken seriously in the hospital, that is. So when we're talking about nurses that want to make an impact, you've got thousands of people that are at the bedside right now who would love to make an impact, but aren't being taken seriously, either because the boss doesn't think that they're the best fit for the job, or they're a little bit of a squeaky wheel and, people like the status quo, they want people to be quiet, or just because they don't know what to do, they don't know where to go with it. So what can they do? Well, they can become an informatics nurse. At least I think that's one of the paths they can take. And one of the reasons I think they can become an informatics nurse, and this is one of the ways they can make the biggest difference without being a hospital CEO or, anything huge in terms of the hierarchy of a hospital, is they have the ability to impact 131 nurses on average for every hospital every day, 655 patients on average based upon those nurses every day, and about 86,000 lives every day. And that's just using the formula that we used earlier and then multiplying it by the amount of nurses that they touch every day. They're not a hospital CEO. In many cases, they're not huge decision makers, but they do have the ability to make an impact and make a difference. And if they decide that the button over here needs to be over there, or that 13 clicks is too much and it should be 9 clicks, they have the power to do that. And they have the power to make one of the biggest impacts on patient care in healthcare technology by making sure that the needs of the nurses are met and that they advocate for those nurses at every conceivable opportunity. But as we mentioned earlier, it's not just the nurses that they're advocating for. They're also advocating for the functionality of the technology. In short, they're the people who know whether or not it can do what we say it can do. And the button example is a really good one, right? Because if it's in the top left corner and you really think it would be, more convenient to be in the lower right-hand corner and you just really think it should be moved, they're the people who can advocate for it. But here's the other side of the coin. What if it can't be moved? What if you get the answer from the EHR company? It's hard-coded. That was my favorite one. It's hard-coded. It has to stay there. Nothing you can do about it. So what happens then? What if that's the end of it? What if you've ran it up the flagpole at your Cerners, your Epics, your Meditechs of the world, your Allscripts? What if you've ran it up the flagpole as high as you possibly can, and you've got the CEO of the company who said, look, I can't do nothing for you. It's going to be there. Use another EHR if you don't like it. What do? Well, as an informatics nurse, you have to work backwards. You have to say, okay, can do nothing about that button. What can I do about everything else to make it work? What about this button is causing such grief? And I know the button example is a funny one, but we've been there. As informatics nurses, we've been there, and sometimes we have to advocate for things that seem small, but are big to a lot of different people. So your job as an informatics nurse is to sort of figure out what you can do to make it work. You problem solve. You use your nursing assessment skills to figure out what the big picture is. Why does this really matter? And who is this really going to affect? Is this really a big deal? And if you flew it all the way up the flagpole and you're beaten down and told you can't do it, you sort of start again and investigate the process over again and say, how does this impact the care that my patients receive? And is, 5 inches to the top of the screen or 5 inches to the bottom of the screen, does that make a difference? Will that save people time? What can I do from there? And sometimes you have to go back to the vendor and you have to say, nope, you're going to have to move that button or we're going to buy another one. And you get your leadership of your hospital to back you. And sometimes they move that button, but not always. So on when they don't agree to do that, you are tasked with figuring out what's the next best solution. You're the problem solver. And those 86,000 lives that you impact, you're going to impact with that. And so you know that every second that you save, every click that you save, or every piece of data that you can provide to the clinician at the bedside at the point of care to make better informed decisions will make a difference. And so the last 15 minutes I want to talk about how to get every nurse involved. Because more than anything, informatics nurses are still going to be a very small part of your profession. And my understanding is the average is about 6% of your hospitals have EHRs fully implemented. Is that statistic correct? give or take some. But with that, knowing it's such a small percentage, you're likely not going to have a lot of dedicated informatics nurses in your healthcare organizations. And you're still at the point in informatics and technology that you're going to have to fight tooth and nail to get those people in place. You're going to have to fight tooth and nail to say, these people matter. It's a specialty, so they deserve specialty pay. You can't just take any nurse off the floor and throw them in this role and expect them to be great at it. And really, it's quite insulting if you take a specialty and expect them to make what they would make on the floor. These people deserve more money. They are doing things with their brains, and they're doing things for the profession that impact in ways that you can't even begin to quantify. Well, I guess we did a little bit. 86,000 people every day, give or take, per informatics nurse. So you have to figure out ways to make it go from the ground up. And so one of the very first things that you have to do is you have to promote an idea of technology empowerment. At the Nursing Informatics Conference on Monday, we talked about the fact that you really can't evolve in technology and healthcare if you don't take care of the lowest common denominator. And the lowest common denominator is the person who you're telling when you implement this EHR system that it's going to change their life. It's going to make their patient care so much better. It is going to impact everything they do. It's going to give them everything they need right where they need it. It's going to make it safe. And you've rah-rahed and you've cheerleaded and you've got them on board. But guess what? They can't type. So you just gave them a lot of lip service. Do you really think that you're going to improve outcomes for patients and even job satisfaction for nurses if you make them use a system and they can't even type? Do you think it's going to make a difference for them? Is it going to be positive? Do you think? By show of hands, is it going to be positive? Do you think it's going to be positive? Negative? How many think people will quit? Some will. How many think people will go from engaged and excited about nursing and healthcare to unengaged and in many cases disengaged? They will make whatever implemented system you have be a nightmare. They're going to fight you tooth and nail every step of the way. They're going to be the one in the back of the meeting who's either so distraught and devastated that they can't even barely ask a question or pay attention, or they're going to be complaining about every single thing you do. And they're going to drive your morale and everything in the tank because they can't type. And it's not their fault. It's not their fault they can't type. You can't hold these people accountable for the fact that generationally they just did not grow up with technology. But what you can do is you can empower them with the tools they need to be successful. And before you start to implement these EHR systems, or before you start to implement anything that's going to affect this person, and assuming they use this technology every day, you need to assess them all and see where they stand. And once you know where they stand, you need to implement programs to get them where they need to be so they have at least a basic level of understanding of technology. And then step 2, once they have the basic level of understanding of technology, you need to make sure they know, without a shadow of a doubt, 100% clear, that they are smarter than their computer. They're smarter than their computer. Seems very simple. But you'd be surprised at how often people just think that it's over them, that they don't get technology. They're not into this. I'm not a computer person. And in my case, with many of the nurses that I've dealt with who are using EHR systems every day, who tell me this, who hunt and peck to find the keys, who it breaks my heart when they say this, because they are. They're excellent stewards of technology, but they don't think they are. And they lack the confidence to really use technology in a way that will improve their work and the patient care that they provide. So you have to make these people empowered by their technology. You have to first make sure they can use it at a basic level, but then you have to make sure that they own it, that they don't use their smartphone just for Facebook, that technology means more to them than just, something that people over here use. And this is not a generational thing necessarily. Yes, statistically, you're probably going to have, your nurses who've been at it for 20 or 30 years are going to be the ones that struggle. But, the people in my generation, the millennials, use smartphones primarily. And a lot of those people would, just assume, not touch a computer at all. And so they may or may not be excellent typists, and they may or may not be fully engaged with the technology that is available to them. So you have to get everybody, on board and on base before you implement. And as you're doing your workflow evaluation, and as you're deciding on the systems you're going to use, and as you're deciding, what needs to be in place to have a successful rollout, if you don't assess the bare needs of the clinicians and the staff that you have in terms of their level of technology, understanding, and education, you're going to fail. And you're going to lose staff. And although you may have got a great deal on your EHR, you're going to bleed staff. And in the U.S., it costs about $60,000 to $80,000 every year to train and hire a new nurse. I would imagine it's probably very similar for you. You're going to be bleeding money because you're going to have to be replacing clinicians. And you know what happens when you get a lot of new staff in your door? Your patient outcomes go in the tank. People die. People die. That's just all there is to it. So after you've done that, the second thing you need to do is you need to confirm the impact on the patients. So if you got your clinicians with this base level of technology understanding, and you've attempted to ingrain this empowerment and the use of technology into them. So not everyone, but a large majority of your staff gets it. They feel confident in the technology they use. You've made it an asset to them. You've motivated them. You've provided them with the resource that they've needed. They can type now. They're really proud of that. They feel confident in learning this new skill. But you've got to do the second thing. You've got to confirm what it means for your patients. And one of the ways I suggest in doing that is storytelling. I suggest you find very clear examples of how implementing technologies in healthcare and implementing bedside technologies, EHRs, can actually improve the standards of patient care. One of my favorite examples I like to use, and again, this is in hospitals that were fully implemented, but I still had lots of resistance among the staff, is how bedside medication verification can actually make a huge difference in impact patient care. So I have worked both ways in hospitals. I have used both a paper MAR, where you check off medications, and I have used electronic bedside medications where you have to scan the patient, you have to scan the med, you have to make sure everything works out, and it does all the checks and balances for you. And there's a huge difference in the confidence I had to deliver patient care. First of all, I'm a human being. I'm not a computer, I'm not a machine. The patient has 22 allergies, whether they're real or not. It's going to be really hard for me to know all the formularies that build up all these different drugs, and whether or not the patient is really allergic. If somebody made a mistake down the line and prescribed something that they weren't supposed to have, they've got 40 medications I have to give them, throughout the day. They have 22 allergies. I have to hope, and for me, pray that I know what I need to know, or else I'm going to spend my entire shift looking up drugs and confirming all this information. That's what happens when you have paper systems. There's a lot of hoping and praying that you're not giving people the wrong drugs. Beyond that, after allergies aren't a consideration, what's the next thing you have to hope that you get right? You have to hope you're giving the right drug to the right patient, which sounds a little silly, but in a world of medications, they're all very similar, and it's very easy for you to give a patient one thing that is meant to be something else, especially if you have them in punch cards and you're carrying around large quantities of different medications all at one time. It's very simple to give a patient the wrong medication. It's very simple to kill someone because you gave them the wrong medication. But in the world of bedside medication verification, you at least have an extra check where you scan the patient, you scan the drug, it does all the calculations behind the scenes, and it will prompt you and say, hey, this person's allergic to that. You probably shouldn't give them penicillin because last time it nearly killed them. Unless you want to be responsible for that, why don't you not give them that? And what if you scanned it and it was just the wrong thing altogether? They weren't allergic to it, it's the wrong medication, it was just similar. It gives you an extra check. And I've been the nurse, and I've been the nurse who has had the wrong medication and scanned it and looked down and had a panic attack because I nearly gave my patient something that they were not supposed to have, because it was in the wrong box, or I pulled the wrong thing out of the drawer, because I'm a human being and I make mistakes, right? We all make mistakes. But having that extra check, that extra electronic check built in, that bedside medication verification built in, it saves lives. And that's a story that you can tell your staff that will help them get the impact of it. And hopefully, by the time you've done that, you've told them a story That's my story. Find your own. It needs to be special and unique to you. It needs to make a difference to the people you're serving. It needs to be primarily related to their specialty. It needs to be something that will matter to them. Hopefully after that, after you've got them empowered to use technology, they're cheerleaders, they're excited about it, they understand the difference it will make in the patient care, they understand the safety reasons, they understand the reason why they're doing it. Hopefully after that, you will have enthused and motivated nurses. And these aren't necessarily informatics nurses, these are just nurses who are excited about the prospect of using technology and informatics to improve patient care. Hopefully you've got your cheerleaders, you've got this happy nurse. Have you ever seen a nurse that happy? I have. It's me. You get people like this, and I joke, I have seen actually other people get this excited about different things in patient care. Unfortunately, I am the only nerd I know that gets this excited about informatics. But when you get them excited and motivated, what's the next things you need to do? You need to recognize it. You need to breed advocacy. You need to get these people to get their coworkers and colleagues on board. You need to get them to have everyone singing the same excited song that they are. You need to get every nurse involved. And nurses respect the opinions of other nurses. And despite the fact that we may be mean and hate each other when we work with one another, we respect the opinions of other nurses. We want to hear what they have to say and we listen to them. And if they're excited about something, even if step 1 and step 2 and step 3 didn't get me where I needed to be, if everyone else around me is excited about it and sees the impact it'll make for patient care, sooner or later I'm going to get on board or I'm going to walk out the door. That's the only choice they really have in the matter. So if you do all those things and you get every nurse involved and you make it a priority to understand the work that we do and you make a priority to tell stories about the impact of patient care and make sure they have the basic level of technology needs and that they're confident with what they do, they will make a difference. Your EHR implementations will be easier, your patient care will be better, your patients will be more satisfied because they will see the beaming radiance that your nurses have when they're confident with the new systems that they're implementing. It'll be more safer, and the world, in my humble opinion, will be a better place. Thank you.